Good morning, everybody, or shall I say good afternoon? Okay, so I've just had a late night last night, hence why the shades, and no, I haven't been drinking. We finished this morning at 7 o'clock, and my shift should have been finished at 6. So even if you are penciled in to finish at a certain time, remember that overruns can and will happen. And if you've got childcare or if you've got other commitments in the morning, just to make sure that you cover those just in case. Okay. I just want to do a quick reflection from last night's calls. What happened was that I've noticed that every time I go to a call when it's like a fall on non-injury, what happens is that we go in there, we just check out the patient, make sure that obviously they're okay, their obs are fine, and we sit them up and put them back into the bed, and we leave them if we need to, or we take them in if we have to. What really was quite profound is that when I realised, after talking to one of the paras, that especially in an elderly person, the mechanism of injury, so the fall, no matter how minor, can always have some kind of major impact on the patient if they're quite elderly. And majority of the time when elderly fall, it's always a good idea to check C-spine. Okay. We had a couple of times, not last night, but just generally speaking to the paramedics and their stories, that the patient didn't actually show any signs of trauma or any signs of pain along their neck, but they had a curvature of the spine. And what's happened with one particular patient is that just because of the really good way of completing the OCSE or completing the ABCDE from the paramedic, pinpointed that this particular patient had a queer fracture of 2-3 of the cervical neck, and that hadn't been picked up 2 days ago from the GP or from even the ambulance service that had originally seen to them. The reason why it wasn't picked up wasn't by the fault of the ambulance service, wasn't by the fault of the GP. It's just that the patient hadn't actually mentioned any pain, and even when they touched that area, it was fine. So you do your normal basic obs and everything else. You do your primary survey, your second survey, and then you take them in. So when I'm now seeing or getting called to fallen injury, in my mind I'm thinking, okay, C-spine. Is it really a C-spine? Can there possibly be any other way that something could be wrong with this patient? The thought about when you go out and do your basics, you have to check C-spine anyway, which is fine. And sometimes it's obvious, like they've had a car versus bike, or they've fallen from a high source. Yeah, so you would check that normally anyway. But when you've been told it's a slide, or it's a slide from a small height, like a bed, to the floor, for me personally, I'm not thinking C-spine so much, and I should. So this is my own reflection to think this is how I need to continue and how to progress as an ECA. So when you go down through a mechanism of a fall, there is always some kind of impact that goes to the body. Sometimes with a fall, that the patient may not know how they've fallen, they may not have witnessed it, they may not know how long they've been down. So that all sorts of things could have happened inside that patient's body. There could be internal injuries, that sort of things. So always check also airways, breathing. Okay, are they breathing? Yes. They're making conversation? Yes. Rest rate, how deep is the rest rate? How difficult is it for them to take a breath? Those sort of things. So airways, breathing, circulation, the whole Dr. ABC, through the way we've been taught. And that way you are checking all those really important boxes, even though it may not seem relevant at the time. It might come back and bite you on the bum. Okay, so that's my reflections this morning, just before lunchtime, and I'm absolutely zonked. These late nights, over morning shifts, 8 to 7:30s or 6s to 6s, have taken a toll on me. So I just can't get my eyes open this morning. All right, so there's my reflection for today. And I have rest day today, so tomorrow I am a normal 7:30 in the morning to 7:30 p.m. So hopefully have a good night's sleep tonight. All right, take care everyone, and I'll catch you later. Bye for now.